U.S. regulators say annual COVID-19 shots for healthy younger adults and children will no longer be routinely approved. It comes as the FDA sets new guidelines based on a patient's risk of getting severely sick from COVID-19. ABC's medical correspondent, Dr. Darian Sutton, is joining me now for the checkup. Great to see you.
Great to see you as
live
well.
and in person. So how significant is this news, and what does it mean for most healthy people who may contract COVID-19?
You know, for the biggest, the big picture here, when you look at it as a person just thinking about getting your COVID vaccine, this likely won't change much in your everyday experience. But what's important to understand is that this is a policy shift focusing on those who are higher risk. For example, those over the age of 65 or those with an underlying health condition. This is in line actually with what we're seeing a movement around the world, you know, in the UK as well as Australia. The question here and what's causing a conflicting opinion among scientists is how vaccines will be reviewed in the future. So previously, the FDA approved a vaccine if the manufacturer was able to show that there was a beneficial immune response compared to the year prior. That's actually how we approve flu vaccines. In this policy change, however, they're asking for something called placebo-controlled trials. Now, this is, as you said, to get a better understanding in the risk-benefit analysis for people who are otherwise young and healthy. The concern here from scientists, where there's a conflicting opinion, is that many are stating that that just simply takes more time on a vaccine that's already studied and can unfortunately limit access to those who are desiring it.
Bottom line, is the COVID-19 vaccine something that you would still recommend even healthy folks get year after year?
Absolutely. And the reason why I say that is because I think that let me give it a little bit more nuance. So absolutely for those who are higher risk, for example, my patients who are over the age of 65, and what people don't realize is that 3/4 of Americans have some level of an underlying condition or health condition they may not be aware of. So I think starting the conversation to make sure that you're not in that high risk group, and then stepping down from that. Are you managing or taking care of an elderly family member? Do you have a child at home that has an immune compromised position? These are reasons why people also should get vaccinated. But again, it starts with a conversation to make sure that you fully understand what's going on.